Good morning,
everyone.
everyone. I am Simon Carl S. Cruz.
I'm Kent Lewis V. Ganiron,
And I came Redarmy or Mancilla.
and
And
for
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 today's
today's
video,
video
we'll talk about prevention and protocol.
testing results and how is it done,
and the vaccine.
we
hope
hope
you
you
enjoy
enjoy
our
our presentation.
What is COVID 19? COVID 19 is an infectious disease named for the crown like spikes on the surface of the virus. COVID 19 is a kind of common virus that causes an infection in your nose, sinuses, or upper throat. Symptoms: people with these symptoms may have COVID 19. Fever or chills, cough, shortness of breath, or difficulty in breathing, fatigue, sore throat, and etc. To prevent infection and to slow transmission of COVID 19, do the following. Wash your hands regularly with soap and water or clean them with alcohol-based hand rub. Avoid touching your face with unwashed hands. Cover your mouth and nose when coughing or sneezing. Wear a mask that covers your nose and mouth to help protect yourself and the others. Practice physical distancing by avoiding unnecessary travel and staying away from large groups of people. There are three types of samples: swab samples, saliva samples, blood samples. Different tests are authorized to be used with different types of samples. There are two types of tests: viral tests and antibody tests. Viral tests are used to look for current infection, while antibody or serology tests look for antibodies in your blood to determine if you had a past infection with the virus that causes COVID 19.
Nucleic acid amplification test or NAAT, a type of viral diagnostic test. Tests detect genetic material, nucleic acids. Identify the RNA sequences that made up the genetic material of the virus. Specimens either from the upper or lower respiratory tract. CDC recommends collecting and testing an upper respiratory specimen such as nasopharyngeal, nasal mid-turbinate, or anterior nasal. Test procedure works by first amplifying or making many copies of the virus genetic material that is present in the person's specimen. Amplifying or increasing the copies of nucleic acids enables the test to detect very small amounts of SARS-CoV-2 RNA in a specimen, making these tests highly sensitive for diagnosing COVID-19. NAATs can use many different methods to amplify nucleic acids and detect the virus. Reverse transcription polymerase chain reaction RT-PCR, isothermal amplification including near TMA, LAMP, HDA, CRISPR, SDA. Because laboratory-based NAAT are considered the most sensitive test for detecting SARS-CoV-2, they can also be used to confirm the results of lower sensitivity tests. CDC recommends only laboratory-based NAAT for confirmatory testing using of specimens that are considered optimal for detection such as nasopharyngeal, nasal mid-turbinate, and anterior nasal swabs. PCR test, also called the molecular test, detects genetic material of the virus using a lab technique called polymerase chain reaction. Test detects the presence of a virus if you are infected at the time of the test and can also detect fragments of virus even after you are no longer infected. A fluid sample is collected with a nasal swab or a throat swab. You may spit into a tube to produce a saliva sample. It is the gold standard test for diagnosing COVID-19 because it's the most accurate and reliable test when properly performed by a healthcare professional. The rapid test can miss some cases. Used to directly detect the presence of an antigen rather than the presence of the body's immune response or antibodies. By detecting viral RNA, which will be present in the body before antibodies form or symptoms of the disease are present, the tests can tell whether or not someone has the virus very early on. Materials included in the diagnostic panel. The real-time RT-PCR diagnostic panel contains 4 regions. nCoV-PC yields a positive result in each assay included in the panel. 3 primer probe mixes for nCoV N1 and N2 target virus nucleocapsid gene for specific detection. Targets human RNase P gene for detection of human nucleic acids controlled for sample integrity. This is a CDC's laboratory test kit for the SARS-CoV-2 virus. Other materials labs will need to perform the diagnostic panel. The CDC real-time RT-PCR diagnostic panel requires the use of additional authorized materials that are not included with the test. These materials include PCR reagents and items that are commonly used in clinical laboratories such as microfuge, microcentrifuge tubes, pipettes, and pipette tips. Tool control materials are also required but not provided. These materials must produce expected results in order for a test to be considered valid. The controls are human specimen control and no template control. How does a COVID-19 PCR test work? These are 3 key steps to the COVID-19 PCR test. 1. Sample collection. Done using a swab to collect respiratory material found in your nose. A swab contains a soft tip on a long, flexible stick that is inserted into your nose. There are different types of nose swabs, including nasal swabs that collect a sample immediately inside your nostrils, and nasopharyngeal swabs that go further into the nasal cavity for collection. Either type of swab is sufficient for collecting material for the COVID-19 PCR test. After collection, the swab is sealed in a tube and then sent to the laboratory. Number 2. Extraction. When a laboratory technologist receives a sample, they isolate genetic material from the sample, including genetic material from any virus that may be present. 3. PCR. Uses special chemicals and a PCR machine called a thermal cycler, which cause a reaction to occur that makes millions of copies of a small portion of the SARS-CoV-2 virus genetic material. During this process, one of the chemicals produces a fluorescent light if SARS-CoV-2 is present in the sample. This fluorescent light is a signal that is detected by the PCR machine, and special software is used to interpret the signal as a positive test result. A positive test result means that it's very likely that you have COVID-19. Most people have mild illnesses and can recover safely at home without medical care. A negative test result means you probably didn't have COVID-19 at the time you took your test. However, it is possible to be infected but not have enough virus in your body to be detected by the test. For example, this may happen if you recently become infected but you don't have symptoms yet. Keep in mind that a negative test doesn't mean you're safe from it for any length of time. You can be exposed to COVID-19 after your test, get infected, and spread the virus to others. If your test is positive, talk with your healthcare provider, stay home, and separate yourself from others. If the test is negative, continue to take steps to protect yourself and others from getting COVID-19. Antigen tests detect the presence of a specific viral antigen, currently authorized to be performed on nasopharyngeal or nasal swab specimens. The performance of antigen tests can be affected if the test components are not stored and handled properly. They should never be frozen and should always be brought to room temperature before use. The package insert for these tests remains in its sealed pouch until immediately before use. All testing for COVID, including antigen testing, depends on the integrity of the specimen, which is affected by procedures for both specimen collection and handling. Improper specimen collection, such as swabbing the nostril too quickly, may cause insufficient specimen collection, resulting in limited amounts of viral genetic or antigen material for detection. Time from sample collection to testing should be minimized, and the temperature of the specimen during this time must be controlled. It can be done in a clinic, doctor's office, or hospital. Turnaround times for results is usually quick, and in some cases results can be reported within 15 minutes. Antigen testing for a symptomatic and symptomatic person. When a symptomatic person receives a negative antigen test result followed by a negative confirmatory NAAT, the healthcare provider should take into consideration whether the person has had exposure to a person with COVID-19 within the past 14 days. If the person has had exposure, that person should follow infection control measure for 14 days after their most recent exposure to a person with COVID-19. When testing a person who is asymptomatic and has had exposure to a person with COVID-19 within the last 14 days, the healthcare provider should confirm a positive antigen test result with an FDA authorized NAAT. Person who receive a positive antigen test result that should undergo confirmatory testing should isolate while awaiting results of the confirmatory testing. In instances of high incidence of infection in the community or a person with household or in continuous contact to a person with COVID-19, clinical judgment should determine if a positive antigen result for an asymptomatic person should be followed by a confirmatory NAAT. the healthcare provider should direct the person who received the negative antigen test result or a negative confirmatory NAAT result to quarantine for 14 days after the last known exposure to a person with COVID-19. When testing a person who is asymptomatic and has not had known exposure to a person with COVID-19 within the last 14 days, the healthcare provider generally can interpret a negative antigen test to indicate that the person is not infected. Clinical judgment should consider whether this negative antigen test result should be followed by a confirmatory NAAT. A positive antigen test result in this circumstance should be followed by a confirmatory NAAT, recognizing that a person will be tested at a later time point in their illness if truly infected. Persons who receive a positive antigen test result that should undergo confirmatory testing should quarantine while awaiting results of the confirmatory testing. Confirmatory testing should take place as soon as possible after the antigen test and not longer than 48 hours after the initial antigen testing. If more than 48 hours separate the two specimen collections, or if there have been opportunities for new exposures, an NAAT should be considered a separate test, not a confirmation of the earlier test. If the person being tested has recently had COVID-19, it is possible for that person to receive a negative antigen test result and a positive confirmatory NAAT, potentially indicating a persistent detection of SARS-CoV-2 after recovery from COVID-19. NAAT and antigen test similarities are both detect current infection, both viral tests, and can be done by swabbing. Differences are antigen tests are easy to use and most healthcare providers are authorized compared to NAAT. There are 7 different vaccines available worldwide. These are AstraZeneca, Johnson & Johnson's, Moderna, Pfizer, Covaxin, Sinovac, and Sputnik V. 4 of them, namely AstraZeneca, Johnson & Johnson's, Moderna, and Pfizer, are evaluated by World Health Organization for safety and efficacy. 3 of them, namely Johnson & Johnson's, Moderna, and Pfizer, are authorized and recommended in US. 6 of them, except for Moderna, received Philippine FDA approval this year. Johnson & Johnson's Janssen is administered only once, unlike the others that have a second dose. Common side effects on the injection site are pain, swelling, and redness, while throughout the body may experience fatigue, tiredness, headache, nausea, body pain, chills, and fever. Inactivated vaccine or killed vaccine is a vaccine consisting of virus particles, bacteria, or other pathogens that have been grown in culture and then killed to destroy disease-producing capacity. Viral vector-based vaccines, such as those developed by AstraZeneca and Johnson & Johnson's, use a harmless virus or adenovirus as a delivery system to trigger the immune system to create antibodies to fight off the infection, which is the virus that causes COVID-19. Viral vector-based vaccines are genetically modified so they are unable to replicate, which means once the antibodies are created, the viral vector is cleared for good. Pfizer, BioNTech, and Moderna use a novel technology that has never been approved for widespread use before the pandemic. This technology uses messenger ribonucleic acid, mRNA, which is a molecule that provides cells with genetic instructions for making protein that are needed for numerous cellular functions in the body, including for energy and immunity defense. While there are similarities in how both mRNA and viral vector-based vaccines instruct cells to create the SARS-CoV-2 spike protein, mRNA vaccines differ in that they don't contain any live virus.
Different COVID-19 vaccines. The best vaccine is the first one that is available to you. Do not wait for a specific brand. All currently authorized and recommended COVID-19 vaccines are safe, effective, and reduces your risk of severe illness. CDC does not recommend one vaccine over another. As of February 18, 2021, at least 7 different vaccines across 3 platforms have been rolled out in countries. Vulnerable populations in all countries are the highest priority for vaccination. Who should get vaccinated? The COVID-19 vaccines are safe for most people 18 years and older. Children should not be vaccinated for the moment. What should I do and expect after getting vaccinated? Stay at the place where you get vaccinated for at least 15 minutes afterwards. Check when you should come in for a second dose if needed. Understanding test results. Diagnostic test shows if you have an active COVID-19 infection, while antibody or serology test detects antibodies that are made by your immune system in response to a threat, such as a specific virus, not used to diagnose active infection. Contact your care provider if there is redness or tenderness where you got the shot that increases after 24 hours or if side effects do not go away after a few days. If you experience an immediate severe allergic reaction to a first dose of the COVID-19 vaccine, you should not receive additional doses of the vaccine. It's extremely rare for severe health reactions to be directly caused by vaccines. Taking painkillers such as paracetamol before receiving the COVID-19 vaccine to prevent side effects is not recommended. This is because it is not known how painkillers may affect how well the vaccine works. However, you may take paracetamol or other painkillers if you do develop side effects such as pain, fever, headache, or muscle aches after vaccination.